Well, hi, Heather. Thank you so much for being with us today.
My pleasure. Thanks for having me.
Heather Janes is a longtime colleague of mine and friend, and really just grateful to have her at the summit today. So, Heather, give us a little sense of who you are and what you do, and the organization that you lead.
Mhm. Well, I'm the CEO of Christie Gardens, which is a Toronto-based retirement home that has been in operation for 40 years. I grew up in elder care and around elder care. My mother was very involved in elder care in this province, so it's kind of in my blood.
Yeah, and Christy continues to make an impact in the elder care market for sure. So, thank you for being here. We're going to talk about partnership and influence a little bit, but before we do that, I mean, you've expanded in different ways some of the work of Christie Gardens outside of the core business of where it's located, and maintaining mission focus as well is always part of what does an expansion look like. Just wondered if you could address that for us first, and then we'll drop into some of the partnership elements as well.
Yeah, around 7 or 8 years ago, when we were working on our strategic plan and honing and reevaluating our mission and our vision, one of the things we were pretty serious about was that our mission is to empower elders to live well.
Uh-huh.
And we recognized at that time that that wasn't just the elders that choose to make Christie Gardens their home, that that was the broader elders, whether that be Ontario or Canada or wherever our influence could land. And that has really allowed us to broaden our scope. We're always very committed to, of course, making sure that the elders that choose Christie Gardens as their home is our primary focus. That is, we've got to be responsible there from every level. But having done this work for 40 years, we know that there's a lot that can be done to improve elder care in our city, in our province, country. And so when we say empower elders to live well, we mean that in a broader sense.
Yeah. And you've been able to do some advocacy work around that. Can you touch on that a little bit?
Yeah, so we recently launched a campaign around ageism. We want to sort of send the broader message that elders have a lot to offer to our city. They helped build it around this country, actually, and they still have a lot to offer. And so we have a campaign called Never Stop Being You, which essentially helps people understand that when you choose to join a community like Christie Gardens, you're not checking your brains at the door. You're not going to just sit around and knit and play bingo. I mean, you will if that's what you'd like to do,
Correct.
but we want to encourage elders to stay involved and to encourage society to recognize that folks at this stage of their life have time, resources, brains, commitment, a lot to offer to us still. So the Never Stop Being You campaign has gone really well the last year.
Oh, that's great. Awesome. Well, let's just jump into the partnership equation then. Partnerships are often about either growth or impact, and you've you've been able to establish a really strong partnership with U of T and Christie. So I'm just curious, can you give us the high level view of what that looks like, and what have been the impacts of that?
One of our strategic pillars was influence.
Uh,
And one of the ways that we want to influence the sector is to influence young people to choose a career in gerontology. And we know from experience that if we hire a receptionist who's training in another field, sometimes they fall in love with our field. That's what I did. I didn't train to be a part of elder care.
right.
Um, but you fall in love with it and you realize what wonderful work it is and how impactful it can be to yourself to work with elders and make that difference. So we have always looked for ways to engage students and young people and draw them into our field. And I met a professor from U of T who was just speaking my language on that. It was like he was saying words I'd said so many times. He teaches an undergrad course at U of T in gerontology, and he was looking for ways to draw students in from other programs and
Okay.
snatch them in for our industry and for
Yeah.
our work. And he's done a great job of that. So we partnered with U of T to create a classroom embedded inside Christie Gardens where students from the University of Toronto come and they study in our space in this course. And we partner them with an adult learner. So
Uh-huh.
we have 25 students from U of T and 25 residents of Christie Gardens who co-learn. And they do the projects together. And at the beginning of the class, it's so interesting to watch how it's a little socially awkward at the beginning. I mean, some of these kids haven't engaged with elderly people. And quite frankly, there's ageism on the other side too. Some of the elderly folks haven't necessarily engaged with 20 somethings in a while. But by the end of the class, true long lasting friendships have been formed. And months later, we have these young people coming and taking folks out for lunch and hanging out. And so there was learning on both sides and really great discussions around elder care and ageism and how we approach healthy aging in society.
Thanks, Heather, for that. So have you seen benefit to Christie from this relationship with U of T? I mean, obviously the interaction between the students and the elders is a huge value, but from a business perspective, have you seen value to Christie?
Yeah, well, really good PR. I mean, it was such a story. All the media outlets were covering it at the time. Um, the folks from U of T, some of the faculty were saying, we've never seen something like this push through so fast. U of T pushed it through really quick because experiential learning, these higher education groups, they really like experiential learning. And this was very experiential. How about we
Yeah.
embed a classroom in the home? So from a PR perspective, it was great. It really aligned well with our media, with our PR campaign around Never Stop Being You. Um, we have a lot of folks living at Christie Gardens who were professors or alumni of U of T, York, these places. The other benefit was pipeline. So we've had a few students from the gerontology class come and do placements with us. We have a
Okay.
social work student
Yeah.
who's doing her placement. We hired on a temporary basis the teacher's assistant from that class, Jessica, who's doing her PhD in the benefits of intergenerational programming for elderly people and for young people. So she's been wonderful in helping us start to set up an academy. We've actually decided, because we've seen that it was possible to do a once a week class in our home, we've actually decided to launch a full-time academy inside Christie Gardens. So there's so many benefits. You get to test and pilot this thing. You get to see that it is possible. The other benefit is we're being asked to speak at conferences quite a bit around encouraging other retirement homes to do this. Do you have a room in your home that's available once a week? Do you have a university or college that's near your community? Then look for ways to do this. It's not as hard as you might think. When I first met the professor, I thought, goodness, how all the logistics around it. And we were just coming out of COVID. So, there was some extra public health requirements around that. But
Sure.
it is so possible if you're willing, and the benefits are huge.
Yeah. So it sounds like you would entertain other partnerships.
Absolutely.
Yeah. Do you have a sense of what kinds of partnerships would be really meaningful to Christie, obviously as an organization, but perhaps to even other players in the marketplace?
We are looking to partner with a company called Greenhouse Projects, which is something coming out of the States. It's a model of care that specifically benefits those living with dementia. And you sometimes think, well, this is an American model, and how's that really going to work, especially right now? I mean, there's a lot of sensitivities around it.
Yeah.
At the end of the day, there's good people doing things and they've maybe dived into an area that you haven't as deeply. They've really done a deep dive. And I love the humility and the co-benefit that happens when you open yourself up to partnering with people that just might know something you don't.
Yeah.
And I think for a while we've known these folks from the States who do the Eden Alternative and this new greenhouse project. I think we've known for a while, just open your ears and hearts to what they have to say. And it's reciprocal because they're learning from us. We do things a little different in Canada too. We do some things we do better. And so they'll be visiting not too long from now to hold a conference in our home. And it's when you allow people in and when you go visit them, there's so much openness and learning that can happen. It's really beautiful. And we've seen that many times over the years. So that's the one we're excited about coming up.
Oh, that's great. Awesome. Being a CEO today, being a CEO in elder care and coming through the pandemic, all of that, and was not an easy time. Can you give us just a sense of what it's like to lead in elder care today in Canada and to be the influence and the partner and the advocate that you want to be.
COVID was a very difficult time for those working in healthcare.
Yeah.
And yet it, in a way, was a beautiful time. You know, with the highways were empty, we were still going to work. You had to, it was 24-hour care, right? So there's many beautiful stories that have come out of it, sad but beautiful stories that came out of it. It was very bonding for our team. And we were already geared to make a difference and have influence. But when the tragedy that happened with COVID, 82% of the people that died in the first wave in Canada were living in nursing homes. We can't forget that.
Yeah.
We must not forget that. And actually, our residents are holding somewhat of a memorial this week because it's the 5-year anniversary.
Right.
And they're having a big program this week just to sort of mark it and say, let's not forget the good, the bad, the ugly, and how we came together.
Yeah.
So leading now, it is very difficult to recruit people. A lot of people left healthcare. So we've got to be innovative, right? If there's one thing we know about COVID, it caused us to move quick and be innovative.
Yeah, for sure.
And also have a measured but an approach to risk, which allowed you to take that next step wisely, even with risk all around. So I'm excited to be a post-COVID leader in healthcare because I think that we have more awareness than we've ever had before, which allows me to be pretty bold when I speak to people about the changes that are needed in elder care.
Oh, that's great. Awesome. Well, Heather, thank you for your time today. We really appreciate it. And just your insights as a leader and the things that you've been able to do with Christie and other partnerships. Just appreciate your time. Thank you so much.
Thanks for having me.
Okay, great.